Hi, this is Jessica DaMassa with WTF Health. I'm here at Upgraded Life Festival in Helsinki, Finland, and joining me right now I have Pasi Heiskanen. He is the founder and head of product development for Noona. So talk to me a little bit about what Noona does. Tell me about the business.
Yeah, so we really help cancer patients to be better connected with their care teams. So we help hospitals to follow up how the patients are doing in between their treatment visits and understand, their symptoms and well-being, and all this accumulates into basically better care, so more personalized care, more timely help for the patients. For instance, if they experience something severe, we can track that early on, intervene, and then prevent emergency room visit.
And where are you based, and where are you helping patients?
Yeah, so we are based here in Helsinki, and also we have an office in Palo Alto.
Okay.
So we have operations currently in Austria, Switzerland. We're also heavily focusing now on the US market because we really see the big potential there. Obviously, US health system has a lot of volume. There are specific players focusing, for instance, only in oncology, called Oncology Networks. So really that is where we are right now.
Okay, I'll come back to that, but I want to go back to something that you were speaking about here at Upgraded Life Festival. You were on a panel talking about design thinking, and so I'm really curious, from your perspective in the work that you're doing with Noona. What is it about design thinking that needs to be implemented into the process of patient care? So tell me a little bit about some of the things you talked about on the panel.
Yeah, absolutely. So first off, if we think about our customer, our user, the patient, its average age is 62 years old. These people have a chronic illness. They are tired, they can have nausea and things.
Yes.
So I think it's really a person in a position where we need good design so that they can use these tools. And for many of them, it's actually the first mobile service or some kind of a digital tool that they engage with. So usability, intuitiveness, joy of use, I would say, are crucial for us. So when we founded our company, among the 5 first people, we had already 2 designers. So take it very seriously.
Yes.
Yeah, absolutely. and so that's about the product. But if we think about our process of making it, I think that's equally important that we involve the users. So also the patients have joined in our design process very early on. We've done a lot of interviews, these workshops where we understand how is it actually to be with cancer. It's a physical experience, but it's also a lot of mental experience.
Right.
And we want to make sure that the patients can accurately describe this with the help of our tools so that the care team can actually provide the help. Because there is help, there is all kinds of support functions on a university hospital, for instance. Sometimes just the demand isn't meeting the need, right? So that's our job to resolve.
What's one of the favorite design features that you've implemented into the cancer journey, I guess, through your work and through your application?
I think really this co-creation workshop with patients. I think there's good energy in there, and it's of course, not only do we get world-class insight that is actually impossible to get otherwise, but you expose our whole company, the whole team, talking to the end user. And that's super motivating, of course, to everybody. We are people who want to help cancer patients. We are not here only to, do code or stuff like that. So.
How has that shown up? Those workshops that you've had, how has that shown up then in your application? Give me an example of how that's shown up, something that's a patient said, and then all of a sudden you had to redesign or whatever it was to integrate something like that in.
Yeah, I think totally. It shows in many of the little and so important details. So a lot of the improvements we've done are basically directly from patient feedback. And it also shows in the new feature sets that we built. Yeah. So really the latest developments, for instance, we renewed the whole patient side user interface during last 6 months, and was primarily driven by patient feedback.
Okay. And I want to talk a little bit about what you said about you're looking to go over to the U.S. So, and you had said it's because of the size of the market there and things like that. As a company that's, European, what opportunity, beyond that, is there anything else that you're excited about in terms of taking your solution to the U.S., things that you can learn or investment that you can gain?
Absolutely. I think the U.S. system, when I look at it, there is probably a little longer trend already about having patient centricity, and there's also been government initiatives to push into data interchangeability, having portals, if you will, to engage the patients. What we see really is that those are the kind of first generation government-driven things. So it's good that there's a culture of getting those on board, but now the leading hospitals are starting to understand that what does it really mean to engage with the patients. So then that's a kind of a perfect opportunity for us to come and pitch in with our kind of product and philosophy, which is not meeting government requirements, is meeting patient requirements, right?
Right. All right, so what are you most excited about, I guess, in terms of like the future of health innovation, not necessarily with your solution, but I mean, as far as the industry is concerned, what has really captured, I guess, your imagination in terms of some of the innovations that are taking hold? What are you excited to see?
Really excited to see like the kind of whole unlock of patient data, that how it can be compiled into big enough registries that can be used also with machine learning, but also with research project, for instance, to help really fasten the drug development, the drug go-to-market timelines, the drug development and research costs, so that they can become much more affordable. And that's actually happening, and having the opportunity to be part of that, I think that's really great. I mean, you really feel like you're helping somebody individually, but you're also helping the society, with your own share.
Very cool. Thank you so much for joining us. It's a pleasure to speak with you and hear what's going on. So thank you so much. I'm Jessica DaMassa with WTF Health.